and Happy New Year. Today I want to talk about fall risk. So, fall risk increases with age, and an elderly person with dementia is at a higher risk of falling than an elderly person without dementia. And here are some reasons why. Changes may occur in judgment and the ability to reason. Your loved one might not be paying attention or might not realize that they need to step up or down on a curb. Their senses of sight, sound, and touch may be impaired. For example, your floor or any other surface may not look or feel the same as it used to, and they make missteps. Changes may occur in their coordination. Now, this one is kind of tricky. You know that your brain tells your muscles in your body how to move. So your loved one may have the ability to walk and make steps or do things like that, but if the brain doesn't tell the muscles to do that, then your loved one might fall. One time I actually saw a man who was walking using his walker, and then all of a sudden he dropped to his knees and tried to push himself up by pedaling his feet back and forth until he got back up and was able to start walking again. So that's one example of what that can look like. There may be changes in the way that your loved one interprets their environment, and that can cause illusions, or they may have problems with depth perception. They might have problems with walking or making steps. Sometimes your loved one will stop at a threshold because they've forgotten how to step over it. And this is common in people with Parkinson's disease or Lewy body dementia. And finally, they may have pre-existing mobility problems. They may have already had trouble walking or getting about. So adding dementia to that creates even more of a fall risk. So here are some things to consider when a person falls. Is the person experiencing medication side effects or interactions? Are medications being taken as prescribed? Does the person have changes in vision? Has the person experienced mobility changes? And is the person restless, wandering, or pacing, or tired? Because remember, the more they walk, the more likely it is that they'll fall. So here are some ways that you can communicate better with your loved one to help prevent falls. So remember the following. If you want their attention, reduce distractions and get eye contact. Make sure you're looking them in the eye when you're talking to them. That way you know that you have their attention. Your loved one might not be able to clearly express what he or she needs or wants. So look for nonverbal cues like pointing, and sometimes they may cry if they're in pain or if they are just frustrated and don't know what to say or do. This kind of behavior can make someone with dementia want to get up, escape, or do anything like that that could create a fall risk. Make sure that you stay calm when you're talking with them and watch your facial expressions, because if you're frustrated, they can sense that. So be careful with your gestures and approach your loved one slowly. Also, use short, simple sentences and give one instruction at a time. Use a verbal cue or a nonverbal cue like pointing or demonstrating what you want them to do. Be sure to allow plenty of time because it's going to take a while. And finally, encourage the person when they are trying to walk and do things that are difficult for them. Encourage them by saying things like, well, good job. Or, okay, take your time. It's okay. You can do it. Consider some of those things when you're trying to mitigate fall risk with your loved one. These are some simple changes you can make in your communication style. So the next time we meet, I'm going to do the second part of the fall risk video. So I hope to see you soon and talk to you later.